How are the most vulnerable going to be protected, and what are people going to do if there's no access to healthcare? Hi, my name is Josie Naughton and I'm the CEO of Help Refugees, Choose Love. We are an organisation that supports the grassroots refugee response all along the migration route in Europe, the Middle East, now also on the US-Mexican border. We are funding the gaps that are being left by government, so everything from children's hospitals to search and rescue boats, distributions of tents, of hygiene items, of food, supporting education spaces, safe spaces for women, accommodation programmes, livelihood programmes and legal support. And this time of Covid-19, we're seeing for the refugee communities that we support that just like vulnerable people everywhere, in fact, they are being disproportionately affected by the virus and by the systemic change that is happening. These camps were already in crisis before the virus. So Moria camp, for example, on Lesbos is home to 20,000 people, but it was an old prison with a capacity of 3,200. The people didn't already have access to proper wash support. They didn't have anywhere to sleep apart from tents that were given out by our partners. What we are seeing now is just an absolute increase in needs. There is a huge worry because people can't self-isolate. How can you isolate and lock down if you live in a tent? How can you wash your hands if you don't have access to running water or you don't have access to soap? And then if there is an outbreak, how are the most vulnerable going to be protected, and what are people going to do if there's no access to healthcare? We as an organisation are having to do all that we can to help prevent an outbreak, prepare for an outbreak, and then also just keep those basic services. We're doing a huge amount of funding and procurement of soap, sanitizer, and then doing a real push into the medical support, and just being very aware as well that the rights of people are kind of being taken away under the disguise of coronavirus. And we just want to be funding the legal support and making sure that people are being held accountable.